Hi there, I'm Lisa and I'm here to talk to you about careers in counselling psychology. So I just wanted to start with this quote. Human nature is not an object for curiosity. It's the source of all our enjoyments, the sum of all our powers. It is the great art to which poetry, eloquence, history, philosophy and all the arts and sciences owe their existence. It's the grand instrument of feeling to which life owes all its interest. It is, in a word, that which makes us to be what we are. It is our very selves. The study of it, therefore, cannot but be deeply interesting. So this is my career. It's somewhat convoluted, hence the maze in the background. My journey started in Stirling University, where I completed an undergraduate degree in psychology. I then went to Glasgow University and completed a PhD, which was ESRC funded, with Philippe Shins. And that was in visual cognition, perception and consciousness. Following that, I returned to Stirling University, where I had an ESRC funded postdoctoral fellowship to develop the work for my PhD. And at that point, I wasn't very sure what I wanted to do. I thought I quite fancied doing kind of more practitioner psychology post. And I saw an advert for the first intake of the clinical applied psychology masters between Dundee and Stirling University. So I was fortunate to get on that kind of first intake of the masters. And my placement was in Fife, and luckily following completion of it, I was kept on in Fife part-time, where I worked for over 10 years. And during that time, I also enrolled on the BPS independent route in counselling psychology. So the British Psychological Society offer a kind of self-study through them independent route qualification. And this was a great option for me because it takes into account prior competencies. So it took into account my PhD and also the masters that I had. And because I was already working, I could self-fund through that and have my placements at my work. I was also a young mum at the time, so it enabled me to work flexibly. When I completed that qualification, I was able to become chartered as a counselling psychologist and also registered through the Healthcare Professions Council. So currently I work in independent practice and there are three main strands to my job. So I provide therapy to clients one-on-one. Usually that is through in Stirling at One Allen Park, where there is a wellbeing clinic. However, since the onset of the pandemic, I've been providing this online. So through Skype and Zoom, and then some clients prefer it over the phone. I also provide clinical supervision, so this is both to trainees who are doing the doctoral course at Glasgow Caledonian and also qualified psychologists. And I also provide consultancy, so some lecturing, webinars. I'm also involved in research and advocacy work. So what is counselling psychology? Counselling psychology is a relatively new branch of applied psychology. It offers a holistic understanding of psychological well-being. So it's very much person-centred and focuses on the therapeutic relationship with an aim of understanding our client's subjective experience. So it takes a very relational approach and we want to understand our client's lived experience, which is clearly very individualistic for each client. But we also want to understand that not in terms of their individual psychological experience, but also in terms of the cultural and social determinants of mental health. So we take a humanistic stance with that drive to empower our clients because we understand that much of psychological distress does come from disempowerment. We work collaboratively with people across a diverse range of human difficulties. So that includes both mental health problems and life issues. So to train as a counselling psychologist, you have to complete your undergraduate degree, and that has to be a BPS accredited programme. You then need to complete a 3-year doctoral counselling psychology qualification or equivalent, so that may be the BPS independent route. And often to get onto that doctorate, much like clinical, you need to have some clinical experience as well. In terms of the doctoral training course, this covers, in our first year, we train as Carol Rogers kind of person-centred counselling, so very much sort of person-centred approach and how to be able to work that way. Then build on that in the second year with a primary therapeutic modality, and usually this is cognitive behavioural therapy. In your third year, you're then looking at a second therapeutic modality. So I am trained in interpersonal psychotherapy, but this is different for different people. Some people might focus on ACT or acceptance and commitment therapy, or compassion-focused therapy. So there could be different schema therapy, different approaches. And you may also focus on taking an integrative approach. You're also required to complete doctoral level research. And one of the kind of main parts of counselling psychology that differs a little bit from clinical is the personal therapy. So there is mandatory personal therapy. You must complete 40 hours. And that's so that you're in a position to use your personal insight of being in the client's chair, but also so that you're very aware of your own stuff, so that doesn't get in the way of providing therapy. So our values in counselling psychology are to be reflective scientist practitioners, to work creatively, compassionately and collaboratively, ethically and effectively. So we will always abide by ethical principles, work within our own competencies, and draw from evidence-based practice. Our vision, so the Division of Counselling Psychology is committed to equality of access to resources, research, education and training, fairness, equality and social justice, leading and influencing the design and delivery of innovative practices and services, and meeting the needs, the psychological needs of people. So you can see there's an emphasis there on equality and social justice. And this is because we know from a lot of evidence that inequality, discrimination, and not being included, so a lack of inclusion, contributes to psychological distress at a population level. So this is a leaflet that we developed in the Counselling Psychology Committee. So I sit on the Counselling Psychology Committee in Scotland, and we get lots of questions, you know, what is counselling psychology? How does it differ from clinical psychology? What is the pathway? So you will find this on the BPS website, or you can click that link, it'll take you directly to it, and answers a lot of those common questions about what counselling psychology is. So just as an example, I work in independent practice. So mainly I work with clients one-to-one. I mostly draw on cognitive behavioural therapy. That's my primary therapeutic modality, but I draw on a range of tools, techniques and other training courses that I've done. So things like compassion-focused therapy, also kind of looking at things like attachment theory, so different kind of theoretical influences there. I'm also really interested in polyvagal theory, so looking at things from a more holistic perspective. And I specialise in adults who present with common mental health problems, so depression, anxiety, phobia, obsessive compulsive disorder, panic disorder, low self-esteem, grief, life issues, so things like retirement, problems at work, bullying. And what I do with my clients is initially I will meet with them for an assessment. And following that assessment, I will develop what we call a psychological formulation. So this is a biopsychosocial formulation that looks at the different contributing factors to the client's current presentation. So the biological factors, the psychological factors and the social factors. And I draw that together and share that with the client. So very much working with them collaboratively. And from there, developing a treatment plan. So drawing on a particular therapeutic intervention, and as I said, that will be kind of mainly CBT based. As practitioner psychologists, we also must have mandatory supervision from another psychologist, so I meet monthly with my own supervisor to discuss my caseload. And that just allows for reflective practice so that I can reflect on the work I'm doing with my clients and get that feedback to make sure I'm kind of on the right track. And it just gives that safe space for me to discuss my current caseload, any blocks that I'm having, but also any of my own stuff that's maybe been brought up that I feel like is getting in the way of that. So I also am a practice supervisor for trainees on the GCU doctorate, and that involves providing supervision, and obviously there's a training element to that supervision, and also placement reports, liaising maybe with placement providers and also the team at GCU. I also sit on the BPS committee in Scotland, the DC division of DCOP committee. And running my own practice also involves lots of other administrative tasks. So preparing for clients, CPD, so keeping up to date, reading, attending courses, attending training myself, writing reports, so liaising with, for example, GPs, maybe providing reports for them, or insurance providers, managing aspects of my business, so invoices, accounts, tax returns, keeping all of that up to date, promoting my website as well. So I'm quite active on Instagram and Twitter and Facebook, where I have a kind of professional accounts. I also respond to inquiries, so I get constant inquiries. I am also on kind of advertise on like Counselling Directory. I also have to register with, like I said, the HCPC, the ICO, so that's the Information Commissions Officer, so you have to register with them. If you keep any confidential data in your house, that has to be locked and appropriately kept. I also have to register, for example, with Disclosure Scotland as well, so there's lots of other aspects to that too. Here are a couple of testimonials from my clients, and I like this depiction of how powerful talking therapy can be. So if you want to read these, then I'll if you want to pause the video and just take a couple of minutes to do that. The one on the left was a fairly recent client, because you'll see they refer to receiving online input and intervention during lockdown. So while I've specialised in adult mental health, you may want to work in a different area, and as a counselling psychologist, you might want to specialise in with children, so kind of paediatric services, older adults, forensic, or there's a range of other things that you could specialise in, medical psychology, just kind of whatever interests you. You can also specialise in other areas, so that might be eating disorders or addictions, just for example, or in other settings. So while I work in independent practice, I could have looked for a post in the NHS or in the voluntary sector. I also contribute to teaching and research, and there are opportunities for that as well. So currently I contribute to the University of Strathclyde's Clinical Health Psychology Masters as an external contributor. So I provide the counselling skills and CBT introductory workshops. So these, I've had to be online this year. And I'm also an affiliate at the University of Glasgow, which enables me to keep up some research that I'm involved in, which is all around psychologically informed medicine. So looking at the impact of the hospital gown on mental health, developing a psychological kind of standardised measure of psychological safety, and that's with collaborators, including Professor Stephen Porges, who's the founder of polyvagal theory, and COVID-19, looking at the impact of that on mental health for people who were born with a heart condition. And all of this work I've been doing with Dr Nicola Cogan, who is a lecturer and a clinical psychologist, and she works currently at the University of Strathclyde, and also other collaborators. So Manos, who's at the University of Suffolk, and he's a sports and exercise psychologist, and like I said, our collaborators at the Kinsey Institute of Traumatic Stress, Indiana University across in the States, and that includes Professor Stephen Porges and Jacek Kolaks. I also kept my hand in with research when I was in the NHS, and there are opportunities for that, particularly if you look at things like service development. So I was involved in the novel development of a self-esteem course and a cultural prescribing scheme, and I looked at the outcomes from this and evaluation of that, and was able to publish the findings in peer-reviewed journals. I'm also really interested in advocacy and social justice. So as I mentioned, this underpins the counselling psychology stance. And this is because we know from the evidence base that often psychological distress results from discrimination, social injustice, inequalities, be that poverty, poor health, or discrimination about gender or race. So I'm particularly interested in social justice for people with serious medical conditions, having lived with a heart condition from birth and being dependent on lifelong pioneering treatment. So to this end, I work voluntarily, and I've done a lot of work trying to improve healthcare provision and psychological access for this population by engaging key stakeholders, including politicians, the media, and our healthcare providers. And some of this work has led to the development of healthcare standards, and I try my best to make sure this work is disseminated, not just within academic journals, but also within mainstream media, so that there's kind of wider access to that information. And I do that as well with my kind of research work. I try to make sure it's disseminated so that as many people can access it and it benefits as many people as possible. So there are just some examples here of this. So more recently, if you can see on the right, I had an article published in The Psychologist where I started to think about ableism in psychology. So within the psychology profession itself, I was interested in the barriers to becoming a psychologist and being included in the profession if you have a health condition. And that was both within practitioner psychology and academic psychology. And there's a little video on my website if you're interested in that about social inclusion in psychology. And the research interests that I mentioned earlier fit within this as well. So trying to challenge some of the cultural norms about, for example, wearing hospital gowns and the impact that may have on a sense of disempowerment as a patient waiting on a procedure, and also looking at psychological safety and how we can enhance psychological safety to mitigate against traumatic experiences, particularly within the hospital environment. So just to kind of summarise, there are challenges and benefits to having a career as a counselling psychologist. It can be highly competitive regarding training courses. It can be a really long journey, so it can take 7 to 8 years. For me, it took more like 20. And obviously there are challenges and stresses along the way. However, if I had to, I would do it all again. I think it's a really meaningful career, has the potential to have a positive impact. The clients I meet mean that I meet a wide range of people with completely different life experiences, huge diversity. And I never failed to be humbled by the determination and resilience of my clients and to play that privileged role in their lives. The work's varied, so in addition to the therapeutic work, you can be involved in research, teaching, consultancy, writing, and that can be as varied as you want. It's about trying to find and create opportunities. One of the main benefits is the colleagues that you'll make along the way. So, you meet like-minded, interesting people, and they will become friends. And it can be flexible, so you can absolutely make it work for you. So here's just a couple of quotes from an article that was in the BPS Digest a few years ago. And it was from end of career practitioner psychologists, and they reflected on their journey in psychology. And they said that it was a burden and a privilege. So it was a privilege, a humbling experience to come so close to other people's lives, to witness their pain and suffering, and see their sometimes remarkable ability to cope and adapt. But it's important to remember that it can also be a burden, feeling so much responsibility for our clients and being exposed to so much suffering. So it's important to reflect on that and think about that before you embark on this career. So thank you so much for listening to me. I hope that was of interest. You can check out my website. So there's a link there if you want to see any of these articles that I've published more recently. There's also some videos on there. So there's some videos about, like I said, the kind of the social justice stuff, the activism work. Also, there's other videos on kind of interviews about being a counselling psychologist and other links that might be of interest. Good luck with your own journey, and I hope that's been helpful.